Welcome, everyone, to today's webinar, A Data-Driven Approach to Reducing Cost and Improving Clinical Quality. I'm Laura Dierda, an Editor-in-Chief at Becker's Healthcare. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see the slides moving or have trouble with the audio, try refreshing your browser. You can also submit any questions you have into the Q&A box, and we're here to help. With that, I am pleased to welcome today's speakers. Jay Spence, Vice President of Healthcare Strategic Solutions at Centellus, and Amy Wolfeld, Senior Solutions and Engineer of Healthcare at Centellus. Amy and Jay, thank you so much for being here today. I will now turn the floor over to you, Jay.
All right, Laura. Well, thank you for the introductions, and I'll just start by welcoming everybody. I guess it's a good morning to folks on the West Coast and good afternoon to all our friends on the East Coast. Thanks for spending some time with us today. First, just to kind of frame the conversation and what we'd like to cover, we'll spend some time, I will do a brief introduction as well, just of myself and Amy, who's co-presenting in just a minute. But we're going to start the discussion just kind of frame from a big picture perspective, some of the common healthcare challenges that we're facing and, kind of around the lens of cost transformation, and we use the term to care transformation. And the way that we've approached this, and I'll tip my hand and say Amy and I have presented before together, but we kind of wear the finance hat and the clinical hat in this discussion. And I'll put the finance hat on for a few minutes. And I think a lot of the work that we do when we think about cost transformation and care transformation is we really do have to approach it from both perspectives, that of the finance role and how they think about the concept of kind of driving cost transformation through the organization, and certainly the particular role and perspective that the clinical team and our clinical stakeholders think of it. So that's how we'll approach the conversation a little bit today. And then we'll close and have some comments around how some organizations are kind of putting some of this into action and motion and provide some examples of that as well. So just in terms of my role, just very, very briefly, I've been in this healthcare decision support analytics space for 25 years or so. And I actually work, very closely with the product management team at Centellus. I also work a lot with our current clients, so have a perspective of how they're using the tools as well. And I will just introduce Amy and just say that it's a pleasure to have her join me today. She's really a great resource for this call. She has a lot of practical experience, but a depth in terms of the tools that are used to really support this kind of work. So Amy, I'll just a shout out to you and thanks again for joining us today. As I said when I started, it's always nice to set the context and set the bigger picture around the work that, we're doing around care and cost transformation. And I really like the phrase that sits in the middle of this slide, so I'll just anchor on that for just a minute. I think for all of you on the call, I would say that the work you do is very much a part of what we would say a multitasking enterprise, right? You're at the same time trying to manage a lot of the disruption that we saw over the last year as it relates to COVID specifically, both the financial, the business, and the operational, and certainly the clinical disruption that was part of all of that. And we're kind of seeing and turning the page on that a little bit. I don't want to get too ahead of ourselves, but at the same time, we're getting back to the focus on kind of the broader market and the new competition that's coming into healthcare today. The focus that we are going to talk about today around bending the cost curve, right? How do we drive kind of efficiencies and reduction in terms of cost across the whole healthcare process and the continuum of care. And then very specifically, all the incentives around that are very much part of, kind of our thinking about industry transformation as well. So again, just for all of you who are on the call that are, working in healthcare and at the center of all this, I think the role that you play within the multitasking enterprise is so important. We talk about cost transformation as part of that discussion earlier, and I'll anchor on that for just a minute on this slide. And what we say on the top of the slide, if I guide your eyes there, is that, it remains a strategic priority. We do an annual survey, and the results that you'll see, and I'll talk to them in a minute, that are on this slide, relate to the finance survey that we do every year, and we've done it for the last, I think, 6 years or 7 years now. And cost transformation has remained as a top strategic priority in every one of the years that we've done this survey. But there are certainly challenges that exist in realizing outcomes and driving change in that regard. So as I mentioned, 9 out of 10 organizations highlighted as a top strategic priority. 3/4 of the organizations that we surveyed came back and said that we've missed targets or didn't achieve the targets fully that we set forth. And almost 7 out of 10 organizations say that they lack the analytical tools that provide a high degree of confidence in their ability to identify and manage and track and realize cost reduction goals and transformation goals that they've set forth. So this is really kind of the business landscape, really, that we're facing, and we talk about, kind of priorities and the process and the tools and the outcomes that we're able to achieve around all of this. One thing that, and I think all of our work, and I include everybody on this phone when I say this, I think we talk about cost transformation, and I'll first kind of anchor on the right-hand side, if I can guide you guys there for just a minute. When we talk about cost transformation, we can kind of really organize that work that we do in different categories. And to the left is really what we would talk about as traditional margin improvement. So as we think about kind of driving cost transformation and think about cost management, we've approached it around the labor topic, around supply chain, and we've approached it around kind of revenue optimization, all things that we're trying to do to improve margin. As we start to work to the right, we start to say that work gets a little harder. And the reason that we say it gets a little harder is it starts to engage a broader set of stakeholders, right? And the work also starts to engage our clinical counterparts and really transforming just how services and how care gets delivered in all the categories that we talk about, including understanding clinical variation and clinical effectiveness, and how do we start to kind of reconfigure that work, as we talked about earlier, to kind of drive cost into the system or cost reduction into that work, but also still realize the quality of care outcomes that we need to see. So the reason I included this slide is I think it's kind of an overarching kind of theme for our discussion today, which is to really be successful at this work. When we talk about cost transformation and care transformation, it's going to continue to require, I would say, greater coordination across finance, operational, and clinical teams. And I think that's really the headline from this particular slide. When we talk about care transformation specifically, and not that this is necessarily an aha moment, but it's just kind of worth reminding that when we think about care transformation, there are obviously cost savings opportunities that we talk about, and there are cost avoidance savings that we talk about. But there's also additional revenue opportunity there, and Amy will talk a little bit more about this as well, but it offers a competitive advantage, transparency, and kind of the new consumer is really curious about care, the quality of care, and the ability to kind of evaluate their care provider. So that ability to kind of have high-level scores offers that competitive advantage as well, right? And there's also that market share opportunity. The more successful we are, the more that brand gets increased, and the more business that we can drive. So there's kind of a foundational business component to all of this. So again, not that this is a revolutionary slide or a new concept, but it's just nice to re-anchor the idea that care transformation is much more about driving quality outcomes, but there's also kind of an umbrella effect in terms of what that can do around driving cost transformation, revenue, and additional market share as well. One of the things when we talk about kind of realizing change or driving change and engaging the market in supporting this work, I wanted to borrow a survey and credit Deloitte for a 2020 survey that they did. And it was really focused around the analytical tools that are being used in this work. And if I look to the quote on the left, I'll just kind of rehash that. The ability and use of data-driven tools to support physicians in practicing value-based care continues to lag. So I included that quote because it was a bit of a headline that started this piece in the surveys that was kind of summarizing the work. And to the right-hand side, these are some of the findings that really stood out. Only 1 in 2 of the physicians, so half of the physicians, are really aware of the cost of the treatments they select. Almost half, so not quite, are comfortable communicating or talking about costs with their patients to potentially influence care decisions. And just under half, again, say they follow the clinical pathways developed by the organizations, which again had been a vehicle in which we could try to standardize care and provided that mechanism to support physicians in the decision making that they have, in more real time. So really interesting survey results, and again, I'll credit Deloitte for that survey, but it speaks a lot about kind of the adoption around the tools that really support a lot of this work. So that's a nice transition or segue a little bit to say that, it's so important as we start to think about perspectives of clinical transformation very specifically. It is a little bit different than the margin improvement work I mentioned earlier, which is really more operationally focused, right? So this slide is really kind of going to frame essentially kind of my role to the left as a finance user and an advisor to the business, how I think about this idea of cost transformation. And to the right-hand side, a little bit of what Amy's going to talk about, which is the work that, and the perspective she brings to this work, I should say, around the clinical care and how they think about kind of outcomes from a patient perspective. So we'll spend a little bit of time in each of these topics here today. So the first question I'll really pose is, what role does the finance function play in supporting this data-driven approach to reducing cost and improving quality outcomes? So I'll pose that question to start, and let's talk a little bit about how we think about that work. I really like the idea of framing the increasingly strategic role of finance, and this is something that, as we start to talk about performance management, that function in healthcare broadly, we've used this for quite a while as kind of an umbrella theme, but it's probably never been more important than as we step away from COVID and all the disruption and uncertainty that we talked about last year, and the role that finance is going to play as they start to kind of chart the path forward for organizations. And they play a role certainly as a strategic advisor, right? They really understand and communicate the financial realities, I'll use that term, and the impacts of every strategic decision that the organization is going to make. Increasingly, what informs the decisions is their data gurus. They're really involved in managing and owning the quality of the data that is being used to drive decisions. And a lot of times that's involving, and increasingly so, the quality of cost accounting data and the important function of decision support, and I'll talk about that in just a minute, and how additional data is getting integrated into those analytics around patient-centric data, service line data, which is comparative data and benchmarking data. And in many cases, they're kind of owning that data and helping to translate what that data means. And on the right-hand side is really the engagement side. The finance function is increasingly working not just with operational leaders, but more so with clinical leaders as well, to really understand, as we used the term before, understanding the financial realities or ramifications of clinical variation, as an example, unwarranted variation, as we should say, and what that really means to the organization. So this is really the important role that finance plays for an organization today, both from a planning perspective, from an analytics perspective, and also from the transformation side of the business as they really start to engage the broader organization around both operational and clinical transformation goals. So I'll guide your eyes to the left for just a minute. I think the lines here are really faint. I'm not sure that you could see them, so I'll talk through them a little bit. But this slide really talks about, defining the imperative. We had a survey that we did as part of the results I just talked a little bit about, and I'll just kind of talk about that. It's not referenced here in the slide, but anecdotally that said, what was the biggest impediment for your organization in really achieving cost transformation goals or results? And on the top of that list was, we lack context around what cost transformation goals, what they should be, and the timing that they need to be realized. So really the broader context of what's the imperative that we need to drive from a cost reduction perspective. And the reason I bring that up is finance really plays that unique role in really understanding what are we trying to accomplish as a business as we look ahead from a financial planning perspective. How do we start to fund all of those initiatives, in whether it's equipment or new facilities or expansion or partnerships? That's capital investment that we need to make. And how do we then take that capital investment and essentially invest it and realize a return on the things that are most strategic to the business? So how do we allocate that capital? And across all the decisions I just mentioned is obviously the ability to fund that on an ongoing basis. So the cash flow implications from a from a budgeting and a forecasting perspective, they have to align as well. So it's a bit of a balancing act that finance teams face, which is understanding kind of what do we need to accomplish as a business, how do we fund that, and how do we sustain that from a business perspective as we look ahead and we look at margins going forward. And the right-hand side is really just the key question that all of this work really helps to drive, which is, are there cost transformation goals that are really imperatives that we need to achieve? So when we talk about the strategic role of finance, and as I wear that hat right now in this discussion, the number one thing that we do is really set that imperative around what potential cost transformation is needed, and we do that as a strategic role, as a strategic advisor to the business. The second thing we talked a little bit about in that slide was the role and the important role of cost accounting, and really the unique role, I'll say. I've had a chance to be part of the decision support function in healthcare. I was on the hospital side for many years, but certainly on the software side today, and work with a lot of organizations. And it is a unique role in terms of bridging the financial picture of our business, the operational picture, to that line of business perspective in terms of what is the cost for every patient that we see? What is the cost as we roll that up in aggregate by service line? And the quality of our cost data, that imperative to get that right and more accurate has really grown as we start to engage the clinical leaders with this data. So let's talk a little bit about, and I'm starting on the left-hand side, I should say, around that, which is the imperatives around driving more accurate cost really start around that, which is the stakeholders that are starting to review that data. We're also starting to expand the quality of our cost data because we're increasingly wanting to understand cost across that continuum of care. And we need to understand that from acute care and non-acute care settings. One of the things that's also important about cost accounting, and we're talking to organizations about this every day, is how do we drive more accuracy into that process? And the more modern EMRs that are getting adopted into healthcare today makes the access to that data much more accessible. And also the ability to drive more sophisticated costing approaches and methods. So the cost accounting tools themselves have continued to evolve. So as I kind of build this slide out here, I'll highlight a little bit about the methodologies and approaches. And, we're working with organizations every day in the roles that we play, Amy and I, around how do we start to drive kind of greater accuracy and efficiency in the process. And a lot of it starts with the inputs into the costing model. So when we think about costing today, which differs maybe from, a decade ago as we started to think about it, is that we have access to more granular cost information as drivers into the costing model. So things like direct item costing. What is the true cost of an implant? What is the true makeup of the surgical cases that we are, of the resources in surgery to support that particular surgical event? What does that look like? And what's the makeup, the mix, and the cost of those resources? Those become important cost drivers that allow us to essentially bring that into the cost model and drive some greater accuracy into that as well. We have the ability to do more around direct item costing. So if we want to, direct cost assignments coming out of things like overhead, marketing, specific equipment, things that we might want to allocate very targeted cost directly to those patients that consume those costs very directly. So without speaking to every one of these methods, as I walk your eyes around this wheel, in addition to, certainly the imperative to drive greater accuracy into our costing models, we have better access to tools today as a finance team to really support that and to drive greater accuracy into patient costing and greater efficiency into that process as well. So again, I think finance plays a really critical role in making sure that the quality of this data is there to really drive physician buy-in. And Amy will talk really about why that's so important. So, I think for this discussion, we had talked, as we planned, it might be good to talk a little bit about how do we get from where we are today, which might be very simplistic costing, to something where we're adopting and implementing and leveraging more advanced costing methods and approaches. How do we even think about that and approach that work as a finance team and within our organization? And I'll start just by saying, to the left-hand side, as we think about this, there's a four-phased approach that we advocate, we'll recommend, and it's pretty simple to think about and talk about. So it starts with essentially an assessment. Each organization, as we think about healthcare costing, is probably on a certain journey, right? They've either adopted it very well and done well with the tools they have, or they're essentially maybe rebooting and really starting to adopt more sophisticated methods and approaches in tools. So it's always great to get an assessment to really understand where are we today and what are the major goals that we have as we look to advance our costing method and approach. Data integration, data sharing is such an important part of costing, so we work on that as a first phase, and making sure that we're going to bring in the right data to drive that accuracy and efficiency into the model itself. As we start to think about the adoption of tools, phase 2 is really focused around making sure that we can run costing as an end-to-end process through that system, and we can support how we're going to go from general ledger costs and other costing inputs, assign that to patients, and fully validate that cost at the back end of the model. That has always been an important function of decision support, to make sure that we have a method and approach to frame how we're developing cost and how that ties back to financials, and how the granularity that we're building into the model can be identified and quantified and communicated into the organization. So laying that foundation is critically important. You know, phase 3 is where we start to think as a finance team, where do we start to add some of those targeted cost accounting methods that improve the accuracy of costing? And I'll say that in this particular phase, we can manage as a finance team a lot of these methods ourselves. We can engage in things like direct item costing that we're doing, standard supply costing. We can bring in that information ourselves. We can set reverse markups in areas like pharmacy if we want to drive kind of a charge as a proxy in the different stages or different ways that we can stratify how we mark up charges. We can make that a proxy for cost. We can manage how that's being managed in the costing system, or define those structures rather, I should say. And we can also set up, as I mentioned, some of the rules around direct cost assignment to different patient populations. Those are just examples of things that from a finance perspective, we can really own and control and rapidly deploy those into the model and gain a lot of increased accuracy. And then the fourth process, and this isn't necessarily done in sequence, but this is kind of the fourth area of focus, is how do we engage in a really strategic way, in a very targeted and focused way, how we advance costing in certain areas like surgery, in the ED, where we might want to drive some more specific, more granular and counter-specific, I should say, cost drivers into our model. So we talked about implants or time spent on the patient and the different kind of sources of information that we can pull from. So those are, you know, kind of a way that we can start to think about compartmentalizing that work and getting very targeted and focused on essentially creating more accuracy and efficiency in our costing model, and kind of adding more sophistication as we go through with our tools. And then, of course, ongoing is that continuous improvement monitoring that we talk about. So I talked about a lot of that, which, you know, all, as I frame that, I should say, you know, that assessment is really where you start. So it's a common question that we get: how do we even begin this journey? And we talk a little bit about creating that current state assessment and framing that future state around the things I just talked about, around data, around the current process and future process that we want to think about, and certainly around the analytics and how we're going to consume that data, and who are the key stakeholders and how are we going to engage them and kind of drive their buy-in in adoption of the data that we have. So kind of took a little sidebar and a deeper dive into costing and kind of getting that costing information right. But, you know, as Amy starts to talk, that is a really important input into the work that she does on the clinical side, is making sure there's accuracy and buy-in and adoption around the costing information that's in the systems that you work with. So the last thing I'll talk about is really that role as a strategic, you know, partner to both our clinical and operational leaders. And I think for organizations that have been successful, and we can say kind of high-performing organizations who really have a focus around analytics and how it's being used to drive transformation work, they really think about that work from two distinct perspectives. One is, how do we start to engage our operational leaders and be very targeted in understanding how do we look at those operational areas in radiology and surgery and lab, and understand where can we become more efficient and more cost-effective in everything that we do in those areas. In essence, drive down the cost of the care activities that we do within my area or my domain as a manager or director. And so analytics that are very targeted in that work become so important. Conversely, and as importantly, we want to be able to engage clinical leaders with analytics that speak the language that they speak, which is really focused on driving quality outcomes from a patient perspective. So understanding, yes, the cost of care, but the quality of care, the utilization that's going into that care, the right utilization at the right time, at the right care setting, and understanding the outcomes as well from a quality perspective and a patient satisfaction perspective. So I think when we talk about kind of taking an analytical approach to driving cost transformation and care transformation, we really need to think about it from these perspectives and make sure that we've got analytics that really support the work both operationally and clinically. So when we talk about decision support capabilities as a function in healthcare today, it really plays an important role, and I mentioned it earlier. But I would also say these systems have really, we've been able to kind of scale and grow the scope of what these systems do and the information that they really bring together. So if we talk about the function of decision support, and for those of you who are in that role, on this call today, you'd really appreciate it. The top line of this diagram, I think, really speaks in a simple way to what decision support really does. We integrate data from a variety of different sources. We normalize that data so that we can start to use it, to make decisions in the organization. So that to the degree that we can really automate and streamline that becomes so important. We enhance that data as well. So decision support is an important tool to really apply cost to patient records. We want to simulate reimbursement and apply reimbursement, both current contracts and future contracts. So again, for those of you who are in decision support today, recognize the importance of bringing that information and that perspective from financial, on those financial metrics into reporting analytics. But increasingly, data and measures. So how do we start to integrate quality and satisfaction data in a perspective on that, both as we compare populations internally and externally. So bringing more clinical data into decision support, and also bringing the perspective around how we compare, as we compare populations across internal data, physicians and cohorts, and compare that also externally. Sometimes the data set just needs to be there to see, from an evidence-based medicine perspective, a larger data set to evaluate that. So integrating not just our internal data, but external data. And Amy, I know you'll talk a little bit more about this in a minute. But we structure data as well in the system, and this becomes really important to make the data meaningful. So we talked about organizing data around, different service lines as we structure the data, around cohorts and around episodes of care. So decision support plays an important role in framing the data so that we can start to make decisions, and to the right, how we analyze that data. So from an analytics perspective, decision support brings data together so we can create a clear picture of volume trends and financial trends, but also we can start to understand where do we have opportunity to improve. And that starts to bring together where we have outcomes from a quality perspective that maybe aren't what we expect and need to be improved, or unwarranted clinical variation that we want to drive down and further standardize where we can. And it really understands those hard dollar opportunities that we can start to set targets and goals around and start to look to achieve. So bringing the data together, again, our technology plays a really important role in how we do that. And for those, again, of you who are on the call, I think would appreciate from a decision support perspective, how we frame that important role as we integrate, enhance structure, and then analyze data with decision support tools. So Amy, I'm going to transition to you, and I'll let you take this slide, and I'll let you put your clinical hat on and share the perspective that you have around this work.
Wonderful. Thanks, Jay. That was a nice breakdown of the financial role and the important aspects as we think about the data-driven approach. So, hi, everyone. My name is Amy Wolfelt. I am thrilled to be here with you and have the opportunity to speak with you all today. I am also part of the Centellus team, and my background is really rooted in the clinical performance improvement space and focusing on patient outcomes, as well as the comparative data component, which we won't be talking as much about today. But as we transition here, just as Jay has highlighted the role of finance and broken down those key components, I'm going to do the same, but here from a clinical and quality perspective. So we're both really representing these different roles and talking through how we can bring them together. We're going to talk through what performance improvement, what data, what the overall mindset here looks like from a clinical and quality perspective. And we'll also spend some time talking through how we're seeing organizations bring these perspectives together, and also how technology can be leveraged to do that. how can we really unite these mindsets for increased synergy? Now, many conversations that we hear today around increasing value, and those often degenerate into discussions around cost reduction, but we must remember that value is driven through improving outcomes as well, and that's what we're going to focus on here for a bit. So to start off, I want to talk about the importance of this clinical role and what that looks like for a team member, how one thinks about, approaches the work. And I know many folks here with us today represent that role from the clinical and quality side. So as we thought about this presentation and how we can break down these different components, the clinical role can look quite different from what Jay has walked us through and talked through. Some may even say that we speak a bit of a different language between the two parties as you think cost and profitability and the numbers perspective as opposed to the clinical detail. And some of that will likely come out here in this presentation today, maybe a few more acronyms that you can become familiar with. But in thinking about all the activities that a clinical performance improvement member is involved in, so from actual patient care to documentation, regulatory reporting components, and embracing evidence-based clinical and management practices, we really tried to boil down the overarching activities as it relates to performance improvement specifically, and we see those here. So first of all, clinical and quality teams are an advocate for patient care, putting each and every patient and their needs at the center of their focus. So the key here is really to ensure that patients are receiving the right care, the right treatments, and that care is timely, it's safe, it's effective. And organizationally, clinical processes are in place to ensure that the delivery of care is the best for each patient, and thinking through really how can we design these processes to optimize performance. In the middle here, this role is also a driver of patient outcomes across different patient populations, which we know that each and every organization truly uniquely serves. So depending upon your location, the community you serve, and so much more. And patient outcomes are really that measurement that help us to understand how well are we doing, how are we caring for our patients. And the ability to understand this type of data from an organization-wide standpoint down to each and every patient will help to identify those areas that need improvement, and we'll talk about that. Essential to this work and the driving of patient outcomes is engaging providers. Jay talked a bit about that, but engaging providers is really key to taking action and to driving change in an organization. And then thirdly, just as Jay walked through, being a partner with the financial and operational leaders as well. So together, coming into one team, taking an interdisciplinary approach to value-based care that's going to involve centralizing data, centralizing analytics and reporting to really help interpret and understand what this data means to us as a whole, and optimizing on our patient outcomes to also improve financial performance. So understanding that impact that quality of care has on our overall performance as an organization. I like to call it the cost of quality. So we're going to break down each of these areas here today. But I think it's important to talk a little bit more about this call to action, something that we are hearing regularly, have been hearing, and especially with COVID, continue to hear even more. And that is this need to engage clinical leaders with trusted and accurate data. I was recently speaking with an academic medical center, and they talked with me about their journey in progressively getting this type of information as close to their clinical teams as possible, because they knew of that difference that it could make, not only in their care delivery for their patients, but on the overall performance of the organization as well. And that really resonated with me, and I think also ties well with some of what we're hearing. So some of our annual survey results really showcase this need and the challenges. First of all, the Centellus Financial Trends Survey from this year, we found that 87% of respondents indicated that clinical quality data is important or very important to their strategic goals. I'm actually a little surprised that that's not higher. I would love for that to be even higher, but showing that need across the industry. And then kind of to address that even further, Kaufman Hall, who's a partner of ours, in their 2020 cost transformation survey, when they asked if clinicians had access to actionable information to help them address clinical variation or other quality-related concerns or cost-related quality concerns, 86% said that they were lacking. So if we turn that around, that's only 14% that had access. So the desire for that data is there, but there's a lack in getting that information out. Organizations know that this clinical and quality data is important to drive decision-making and to reach performance targets, yet there's this challenge in getting that information out there. So with that, what I want to do is go ahead and break down this role of a clinical and quality performance improvement team and how this role can help to address these challenges. We're going to cover those three components of being a patient advocate, driving outcomes, and being a partner across the organization. But to start off here, the clinical performance improvement role requires the right mindset. And I think that really begins with being an advocate for patients. This is likely one of the more prominent differences from our finance and operational roles, as Jay just walked us through, as it really requires that clinical knowledge and expertise and an understanding of patient needs. The Institute for Medicine wrote a book a number of years back called Crossing the Quality Chasm, and it called for fundamental change in terms of how we close the quality gap across the country. And it specifically called out 6 aims for improvement in care quality. And, in thinking about this presentation, I thought these 6 components are really great for setting that foundational mindset as a clinical performance improvement team member and thinking about your role as a physician, as a patient advocate for care. So care needs to be safe. It needs to be free of harm. Care needs to be effective. Are we providing the appropriate evidence-based services? We're not under or over-utilizing different resources. Is care patient-centered? Are the patient's needs at the forefront of our clinical decisions? We need care to be timely without harmful delays. We need care to be efficient, waste avoidant. That includes services, the energies of our teams, supplies, equipment. And is care equitable for all? Including this, where quality of care provided isn't varying because of anyone's personal characteristics. So thinking about social determinants of health in more detail. So these are all components of really how this clinical perspective may think about their role as a patient care advocate that may drive decision-making and impact the data that's needed to perform their job. But do we have the data to help us understand and measure if we're providing safe care? Or do we have the data and information that we need to understand throughput and understand if our care is timely, and so on? So I think this translates well here to the next component, which is being a driver of patient outcomes. So with those foundational aspects of the mindset in mind, one can really truly begin to focus on driving patient outcomes that uphold those principles of patient care. And data plays a really important role here. A former colleague of Jay and I used to always quote, I'll call a modern management principles and practices, Peter Drucker, who had said, "You can't manage what you don't measure." The important component of driving patient outcomes is the ability to use data in a number of ways, including measuring performance so that we can better manage. And as we think about driving patient outcomes, what do we need to do? We need to be able to cascade performance from the organization-wide down through all the way to each patient encounter. So that includes levels of accountability at the entity level, service line levels, nursing units, physician groups, or individual physicians. thinking about the 80-20 rule and being able to focus in on specific patient populations as well, and identifying those high volume, high risk, high cost populations that can really begin to help you move the needle. And data plays an important role in identifying those populations as well. Secondly here, opportunity identification and strategic initiatives. Organization-wide, we need to be able to identify opportunity. We need to inform our teams and our leaders of our strengths and where we have challenges or problem areas that may be impacting patient care and outcomes and driving the costs that Jay has talked us through. So identifying where we have high complication rates or prolonged length of stay, where are patients coming back regularly, having readmissions, where are our patient experience scores being impacted. So data plays an important role in driving patient outcomes across the board here. And then clinical processes and throughput, we need data to really inform those. So how can our processes be improved based on what we're seeing in our patient outcomes? I'll use a very simple example, length of stay. Length of stay is something that a finance team may be monitoring independently, operations as well as quality. And how can we use the performance looking at length of stay to think more about our clinical processes, think about our care management models, discharge planning. So using data to help us build out and inform our clinical processes. And then finally, we need to understand the undertaking and the needs around regulatory reporting as well. It's an important component here. On a regular basis, we know that most all organizations are out there with team members that are managing performance and reporting needs that really require reliable data for many different programs. So whether that's CMS regulatory program across many different care settings, other pay-for-performance programs or payer-based needs. Think of infection prevention and hospital-associated infections. Also consider the different reporting that's visible to the public eye. We need to understand performance because our performance is going to be out there for everyone to see. So, CMS, the star ratings, your leapfrog scores, and more. But overall, patient outcomes really spanning such a broad area within an organization and having implications that a quality and a clinical performance and improvement team must manage. But it has talked us through on the finance side. To be just a bit more specific into the ties with finance, I think a great example is around the optimization within pay-for-performance programs. We know that value-based care is really here to stay and will continue to evolve. Here are just a few of those programs that we know organizations are monitoring on a regular basis that have reimbursement implications as well. So it's important that we do understand the cost of care behind it, in addition to performance across the measures upheld in each one of these programs. So each one of them, a handful of metrics that we need to track, trend regularly on a timely basis, all with implications from a reimbursement standpoint and potential penalties depending upon performance. That is also inclusive in the bottom right of our managed care contracts. We know many of those are trending towards increased or risk-based contracts with payers, and it's important to have that data behind the scenes to really lead negotiations to ensure a profitable result from those negotiations and the agreed upon contracts. So very important component as we think about driving patient outcomes and the impact that it also has on the financial side of the organization. I have a quick example of, we have a client that we worked with closely in Texas that received a pretty hefty penalty from Medicaid based on their performance within potentially preventable complications and potentially preventable readmissions, PPCs and PPRs. It was equivalent to millions of dollars that they were hit with from a reimbursement standpoint. But using a data-driven approach and really focusing on those outcome metrics, we're able to come together as an interdisciplinary team and in a detailed way, dive into the data, get down to individual chart reviews to identify those problem areas, which was specifically around obstetrics and a few specific complications. But as a result, they put decision points in their EHR. They put clinical documentation improvement initiatives in place, increased the feedback loop across the organization, which included increased communication between their coders, their physician leaders, the providers, and other quality teams to ultimately reduce that penalty in the following years. So just important to understand the impact on the financial side and reimbursement driven from the performance across these outcome metrics. So again, this role of understanding and driving patient outcomes is really an essential part of the clinical role. Now I want to come back to this. Jay talked us through this view earlier, but thinking of it on the flip side, the clinical role requires the interdisciplinary partnership with finance and operations as well. So engaging operations and financial leaders as well as clinical leaders in performance improvement efforts through a centralized and comprehensive approach. So while we know that both and all teams need to carry out their individual functions, the synergy between the comprehensive approach can really help to move the needle. And if you think about on the right-hand side, those items under the clinical leaders component, looking at quality, patient safety, satisfaction, also inclusive of cost and utilization, how those areas impact what we see under operations. How does that impact our revenue, our expenses, our labor and staffing, and overall financial health? So a very important tie between those two. So what is needed for this partnership? One of the core areas that we talk about on a regular basis is taking a balanced approach to data, analytics, and reporting. A balanced approach meaning that we are looking equally at all components. We're not focused on just the cost of care. While our quality of care may fall short, we're not focused on just quality while our cost of care is driving up, but that balanced approach across all of the key areas. This also includes the ability to use reporting and other visual management systems to communicate performance that helps to comprehensively bring this type of information together. I'll talk through an example here in just a bit of how some of our clients are doing that. But this includes getting that financial cost information out to clinicians who are making those bedside decisions, as well as understanding how increases in patient complications, patient events impact our profitability, the cost of care, and so much more. So that cost to quality again. But this balanced approach, very important. And then other components, characteristics of the data that's really needed from an improvement standpoint. First of all is providing standardization. We need a single source of information across teams. That information needs to be standardized from a measure standpoint. Are the measure definitions standardized across an organization so that the finance length of stay is the same definition calculation as quality team's length of stay? That also includes standardization across how we aggregate the data. For example, how are we defining service lines? And much more from a standardization standpoint. The data must also be trusted. That's an extremely important component to create this culture around accurate, trusted data. We need validation by all stakeholders upfront and on an ongoing basis. We need sources to be identified and communicated regularly. We also need champions and experts who really understand the data and can help communicate data across the organization, as well as we need buy-in from providers, from clinicians, and that's really essential to drive change. If we have trusted data, we can begin to look at this data from an actionability standpoint as well. From an actionable standpoint, we need data integration that links and ties multiple sources. We need data enrichment, so taking an encounter set of data, tagging it with meaningful metrics that are standardized, utilizing modern cost accounting engines like Jay talked through earlier to provide meaningful look at the cost of care based on the activity that's going on within the organization to care for that patient. And that also includes utilizing comparative data to help look at variances, understand trends within the market. So actionability, really important from an aggregate standpoint and being able to drill down to root cause, as well as related to a team's day-to-day tasks. The data must also be transparent and drillable. Transparency and the release of data within an organization, especially up front, is definitely a journey. And it's really important from an actionability standpoint that data be transparent as well, and the ability to take high-level information and drill through that down to individual patient records. And we haven't talked about it yet, but this aspect of severity and risk adjustment, we know that not all patients are alike. Organizations are all caring for different communities and different types of patients and with different needs. So severity and risk adjusting data is going to provide meaningful analysis, meaningful opportunities to drive any improvement efforts that may be going on. All right, so I have one example of how we're seeing this being done here within one of our clients, and then I'll hand it to Jay, who will walk us through some closing thoughts. But this is an example from West Tennessee Healthcare. West Tennessee is a wonderful partner of ours. They utilize both our financial and our clinical solutions, and they recently shared some of the work that they're doing to put reporting in place that provides really a comprehensive look at performance across their core strategic pillars of the organization, and we see those going down the middle. So breaking down these strategic priorities, that's inclusive of financial components, quality, safety components, insights into patient access, as well as components around their staff. But the goal here being to drive directors, drive leaders to a single place that uses a common data source and gets leaders all looking at the same information on a regular basis to help to create and foster the culture around continuous improvement. Now, each of these areas, you'll see if you look to the right, has accountable metrics. These are just examples, and each one of these metrics with goals and targets that they're tracking and trending towards on a regular basis. Now, one of my favorite components of this story is that this was created using an interdisciplinary approach across teams. So from their executive leadership, their finance teams, their quality teams, to arrive at what they want to hold their teams accountable for in the creation of this comprehensive dashboard. So some really great work being done, and I really look forward to learning and hearing more about the accomplishments as a result here of this work. So I hope this has been helpful here in discussing this role from the clinical perspective and bringing it together with finance operations as we think about performance improvement and using a data-driven approach. So with that, Jay, I will hand it back to you here for some closing thoughts. Jay, are you there? You might be on mute.
Yeah,
I'm
here, sorry. I was wondering why I asked if you could hear me okay. You didn't answer, so that was my fault. Yeah, thanks for that, Amy. And yeah, I'll just make some closing remarks. I won't rehash some of the things that you just went through, but just give some sound bites around, the major themes for today. And I think, we talk a lot about cost and quality and bringing data together. And I think the success that Amy talked about with West Tennessee is one example, is that interdisciplinary, cross-functional team approach that they took. And it really helps to bring organizations together to make sure, are we focused on the right things? Are we measuring what matters? And are we measuring the things that most impact, the business in the ways that we want to affect the business? And I think that kind of classic kind of scorecarding methodology or approach that you take to this is important. We also talk about using analytical tools that make the data, and I like this term consumable. So many times we hear, in healthcare organizations today that there's so much data right now that we're trying to manage, and sometimes it's hard to make sense of that data. So I think the effective scorecarding approach that West Tennessee used was a good example of just making sure that we can distill, the things that matter most onto a scorecard and just get focused on that, create alignment around those being the most important measures, and providing some consistency around how that data gets presented in a timely way. And we've talked about this quite a bit, and I know I was able just to look briefly at some of the chat questions, and I think we'll have time for just a couple, but the creation of a trusted source of information, I think that's always been a challenge, and Amy described it a little bit, creating standardization and getting data into a format that there's common definitions so that we're talking the same language. I'll use what you used, Amy. That language is consistent as we start to talk about our data and how we're measuring things and how we track things. And also the timeliness. I would say that one of the things that's probably changed a bit from COVID in terms of priority has been just the urgency around getting more timely data. So if you look at some of the traditional systems that we're using to kind of measure the volume of clinical cases and some of the outcomes, a lot of it's been around decision support data, and organizations are trying to kind of increase the timeliness in which data is coming into those systems and getting updated so it does become data that's actionable, data that they can start to look at in a more timely way. So I think the team approach, a focus on measuring what matters and making that data consumable for users, providing it in a really a familiar and consistent way. And then finally, we talked a little bit about this throughout the presentation, which is a trusted source is just so critically important. So those are some closing remarks, and I'll hand it back to you, Laura, I think, for some questions. I know we don't have much time, but maybe time for one.
Absolutely, absolutely. And thank you so much, Amy and Jay, for a great presentation. We'll now begin today's question and answer session. You can submit any questions you have by typing them into the Q&A chat box on your console. Let's jump into the first question. How would you recommend we begin the process of incorporating advanced costing methods?
Yeah, Amy, I'll take that really briefly. And with time, I'll just say, I think one thing that's worked really well, getting focused. I mean, cost accounting has been around the industry for a really long time. I was doing costing in the mid-90s. And I think a lot of times cost accounting systems, people waited for the data to be perfect before they rolled it out. So they spent a lot of time refining cost standards. And I think the secret to doing it well is getting very focused and targeted. Bring that cross-disciplinary team together, recognize those areas that are high value that you want to really refine cost, like in surgery as an example, and get targeted with that initiative and that approach that you take. And doing it in that way. Initiatives-based, getting strategic in terms of what you focus on, those are the things that I would recommend.
Thank you for that explanation. I think that's so helpful. Now, the second question we have here is what's needed to drive physician adoption around this type of data? Do you have any recommendations on what's needed to promote that type of adoption?
Yeah, I can take that. So physician adoption can be a challenge for sure. I think I used the term journey earlier, and I will use the term journey again. It's definitely a journey. I think starting with some of the core characteristics of data that we talked about a few slides back, so having a clear understanding of sources of data, data validation up front and on an ongoing basis, as well as standardization can help as you think about the data. Now, from a rollout standpoint, there's a number of ways that we see clients do this, but just a couple ideas here, starting with physician leaders and getting buy-in from those leaders and then further roll out from there, or also considering areas where you may have individuals or groups who can help to champion and gain buy-in from those parties as you roll that type of information out and gain physician buy-in. As you think about the reporting, physician group data is a great way to begin to approach physician level reporting and then further getting out to the physician level when you're comfortable. But overall, as you roll data out, education is really important around understanding the metrics, what the metrics mean. If there's comparative data involved, how does that severity and risk adjustment work? Who are we comparing against? Understanding definitions and attribution is another area that will be important, especially with providers.
That's all the time we have for today. I want to thank our speakers for an excellent presentation and Centellus for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today. We hope you have a wonderful afternoon.